Welcome to this Access Anatomy screencast from the University of Leeds that's going to outline the kidneys and also the blood supply to both the kidneys and suprarenal glands. So if we start off by roughly drawing out the position of the kidneys, then here we can see we have the left kidney and here we can see we have the right kidney. Now both of the kidneys are approximately positioned between the 12th thoracic vertebra superiorly and the 3rd lumbar vertebra inferiorly. The right kidney is somewhat lower than the left sometimes due to the presence of the liver. Now if we start off by looking at the blood supply to the kidneys and suprarenal glands, then we can see that both of the kidneys are going to be supplied by two branches of the aorta. So here we can see the aorta. Remember, the aorta passes into the abdomen through the aortic hiatus at the level of the 12th thoracic diaphragm. It passes at the level of the 12th thoracic vertebra. Remember, it passes through the diaphragm. And here we can see coming off the aorta we have a left and we also have a right renal artery. So here's the left renal artery, and then over on this side we can draw the right renal artery. So here we go, here's the right renal artery. And then the aorta will carry on down the posterior abdominal wall. We can also add on to here a few more landmarks. So here we can add just above it and just above the branching of the renal arteries and approximately the level of the 12th thoracic vertebral level we have the celiac trunk, and then at about L1 we have the superior mesenteric artery, and the renal arteries are coming off at a pretty much the same level at around about L1, and then coming off around about L3 we have the inferior mesenteric artery. So here we can see the two renal arteries coming off the aorta. Running to the right of the aorta, and always running to the right of the aorta through the abdomen, we have the inferior vena cava. And here we can see just a section of the inferior vena cava. Remember, it's been formed by the union of the left and right brachiocephalic trunks, and here we can see the inferior vena cava. What we can see here, and while I've drawn this gap within the right renal artery, is that the inferior vena cava is lying anterior to the right renal artery. And here we can see we have the right renal vein. So here we can see the right venal So here we can see the right renal vein. The left renal vein is going to pass anterior to the aorta. So here we can see the left venal vein. We can see it passing anterior to the aorta. So here we can see the right, and here we have the left renal vein. And these are the main blood vessels that pass to and from the kidney. We can also on this diagram now draw out the two suprarenal glands, and these are just sitting on top of the superior pole of both kidneys. So here we can see the left and the right suprarenal glands. And because these are glands, because they release some important hormones, so like corticosteroids, that are associated with the sympathetic nervous system, so increasing blood pressure, etc. These have a rich blood supply. And the blood supply to these two glands is primarily from the aorta and its branches. And the arteries that supply the suprarenal glands are called the superior, inferior and middle suprarenal arteries. So here we can draw the superior, here we have the middle, and here we have the inferior suprarenal arteries. So we've got superior, we've got a middle, and we've got an inferior suprarenal arteries. Superior, middle, inferior suprarenal arteries. And where do these three arteries come from? Well, the superior suprarenal artery, that comes from a branch of an artery that's coming from the aorta, and this is known as the inferior phrenic artery. The inferior phrenic artery passes towards the diaphragm, and as it passes towards the diaphragm, it gives rise to the superior suprarenal artery. So here's the inferior phrenic passing towards the diaphragm, and it's giving rise to the superior suprarenal artery. We can see we have another one on this side passing over towards the diaphragm, giving rise to the superior suprarenal artery. We can also see that coming directly off the aorta, we have the middle suprarenal arteries. So here we can see the middle suprarenal arteries, and these are coming directly off the aorta. And we can also see here, coming off the renal arteries, we have the inferior suprarenal artery. So here we have the inferior ones coming directly off the renal arteries. And here we can see the blood supply to both the suprarenal glands and also the kidneys. So now if we just turn to the gross anatomy of the kidneys, then let's start by drawing out. So now if we just turn to the gross anatomy of the kidneys, then we can draw out a representative kidney here. And what we can see is we've got a superior pole towards the top of the kidney, and we've got an inferior pole down here at the bottom. So here on the right hand side, the superior pole would be up against the liver, and on the left hand side it would be resting against the spleen. We have a long and curved lateral border, and this medial border is indented at this region, which is known as the renal hilum. So we've got the medial border, and then this indentation has the renal hilum. Now what we need to draw into here are a series of structures, and these primarily are known as the renal pyramids. The renal pyramids are important as that is where most of the nephrons and the collecting ducts are formed. And these collecting ducts are important in passing the urine to the ureter, which we'll see in a moment. And what these do is these form a ring here, which is known as the medulla. Here we have the outer cortex, and this line associated with the renal pyramids differentiates the medulla from the cortex. So here we've got our renal pyramids. So these are renal pyramids. And we can see that we have bands of cortex. So here we can see the cortex. Here we can see the cortex of the kidney. Remembering we've cut this kidney in longitudinal section, so we've cut it so we can see the insides of the kidney. Here we've got the cortex, here we've got the medulla, and we can see we have bands of cortex that pass in between these renal pyramids. And these bands of cortex passing in between the pyramids are known as renal columns. So bands of cortex passing in between the pyramids are known as renal columns. We then have at the apex of each renal pyramid, we have what's known as a renal papilla. We have a renal papilla. And these open into what are known as minor calyces. So the urine that's been formed within the kidney then has to pass into the ureter. And to do this, it passes through the apex, the renal papillae, of these renal pyramids. So what we can do is we can draw out a few of these minor calyces. So here we can see, if we just draw these interconnecting lines, we can see we have a whole series of these minor calyces. So here we can see one here, a minor calyx. And here we've got another minor calyx here. Here we can see another minor calyx. We can see a minor calyx here and here and here. And these renal papilla are opening into these minor calyces. So a minor calyx, that is the singular, and then these can be minor calyces when we're referring to many of them. Each of these minor calyces are going to open into a larger major calyx. So here we can have 2 or 3 minor calyces opening into a major calyx. And here we can see another major calyx. So minor calyces are going to drain into a major calyx. 2 or 3 perhaps of these major calyces are going to form the renal pelvis. And the renal pelvis is dilation, this dilated chamber that's formed within the renal hilum. The renal pelvis is then going to pass out of the kidney. It passes posterior to the renal artery and the renal vein, and here we can see the renal pelvis tapering down and narrowing to give rise to the ureter. So here we've got the renal pelvis, and then we can see it narrowing to form the ureter. So here we can see, as we've cut the kidney in longitudinal section, we can see the main features of the insides of a human kidney.